Hello and good evening. Dr. Shishir, our speaker today, has joined us, and welcome all to Vedicus seminars. My name is Ofra. I'm from Israel. I'm a student of Dr. Shishir and I'm a part of the Vedicus Foundation staff. Welcome everyone. Today is Vedicus' 7th birthday. The portal of Vedicus.com was launched on December 22nd, 2015 by the Honorable Ayush Minister P.G Ayurvedic, and Dr. Shishir was part of this event and a very big supporter of Vedicus activities. Vedicus is all about to reflect upon society health with the ancient wisdom of the Vedas. And Marma therapy was one of the ancient secrets that they are to revealed by. You can read more about Vedicus Foundation and our website, Vedicus.com. But I would like to introduce to you my mentor, my friend, and my teacher, Dr. Shishir Prasad, who have started his journey as student for Panchakarma in Patna University, and then later on he went through Shalya Tantra. He also have a diploma in yoga, and he's associate professor in the Shalya Department Tantra in the main campus of Dehradun University in Uttarakhand in Dehradun. Dr. Shishir is training BAMS students and postgraduate students. He's mentoring many. He's also running many government programs, like the Himachal Pradesh program for training how to run marma therapy. Since Himachal is very hilly, it's very important to have such project. He was a guest of the Nepal government and also had a unique program there during the COVID time. He have more than 24 publications and wrote 3 chapters. One of them is for AIMS Rishikesh. And there in this chapter, he also reveals part of the marma therapy, and a lot of his knowledge is Shalya Tantra. I have to say that he didn't mention it never in his CV, but he's an expert in Kshar Sutra, which is one of the very unique things that Ayurveda have to offer. And maybe someday we'll agree to talk about this. But for now, he has been a guest in more than 15 countries, and he gave training to more than 50 nationalities, Europe, South America, and Central America, and North America, and there is a lot more to come. And of course, he was a guest here in Israel, and we expect him to come again. And since the topic is very sensitive, and it's very important to Dr. Shishir that things will get accurated, he has also accepted the nominees, and he's part of the expert committee of marma therapy of CCRAS, the government of India, part of the Ayush, and they are about to have the marma therapy inside of the syllabus of BAMS student and Ayurveda practitioners in order to have it as a good program and not just, collecting knowledge from here and there. So please, Dr. Shishir, share the knowledge with us, and thank you for joining me.
Thank you, Ofra, for the kind words. It's always been a pleasure to see you around, and you have been also doing a wonderful work of related to Ayurveda in Israel, and it's good to have all the participants here. Thanks Vedicus Foundation for inviting me for sharing this experience, the clinical experiences that I've had in the field of marma science. And so today we are going to talk about the clinical applications of marmas in daily life and some of the common problems that I have chosen. So I'm just going to explain the marmas which one can do to take care of those common day-to-day life problems. Basically, I will be talking about the self-marma therapy. But before I begin, I'd just like to say I've not been only the student of Panchakarma in Patna. I was an undergraduate or a BMS student in Government Ayurvedic College, Patna. And and then after the BMS, I did the post-graduation from Rajiv Gandhi Govt Ayurvedic College, Paprola in Uttar Pradesh. Yeah. So, okay, so I think we can share the slides now. I can share now. Okay, so this is a case of frozen shoulder, which we treated in Mexico. I'm just going to share a video of this patient. And actually, I'm sharing this video because you see, I did not do many times the marma therapy for this patient. And I did tell him how to do the marmas after I did it twice in the same day. And he followed it up for around 1.5 months for self-marma therapy, which is quite important. And that is what I'm going to focus today, the self-applications or the clinical applications for self-therapy. This is the facial expression of the patient before treatment. The patient was having this problem for 6 months and almost thought that his shoulder movements will not be back.
Okay.
The same patient. The next video. So you can see after doing the range of movement increased by 25 to 30 degrees on the same day, and the facial expression also much less strenuous and much less feeling of pain. After that, he did it for 1.5 months and then again shared a video in which almost all his range of movement was back. This is another case of secondary frozen shoulder in Berlin. Actually, the lady is from another country in Europe, but she was having this problem for 3 years. And you can see the range of movement of the shoulder before treatment, and on the same day, the range of movement after treatment of marma therapy. And again, I taught the lady how to do, and she had to follow it up for around, I think, 2.5 to 3 months. And then she also said that her range of movement was remarkable, although it did not completely return because she was having other problems besides frozen shoulder. This is a case of macular edema, and of course, I'm not an ophthalmologist, so I do discuss these cases with my wife, who is an expert in Shalya. So this was a case treated in Italy, and the patient had come there, I think, 2019 June, and he had taken some injections in the eye 5 times, and he said that I want to do the marmas for this. At that time, I had very little experience of doing the cases of macular edema through marma therapy. But I told him, you see, at that time I had done 3 cases. So I told him that I've done this much, and if you want to do, I can tell you, but I cannot guarantee that it will be beneficial for you. So he willingly agreed, and then he did it. And again, I went to there in October 2019, and he came driving to pick me up at the airport, and his vision was much better. So I have had around 6 cases of such macular edema treated through marma therapy. And of course, I did give him some Ayurvedic medicines like Triflagel Netra Prachalan, and a couple of them as an oral medication besides doing the marmas. But the response was quite good, and not only on the subjective parameter, also on the OCT, it showed improvement. And so far, already been nearly 4 years, so I have not needed to take any more injections. This is when I was invited by the United Nations headquarters in New York by the WAFNF organization, which is the only organization based in, or only NGO based inside the UN headquarters, which is called the World Association of Former United Nations Interns and Fellows. And Professor Valdemar organized this, and we had very good scientific interactions there. This was in University of Cologne in Germany, in the nanotechnology department. The scientists there had also shown good interests in the science of marmas. And this, of course, Ofra is the one who organized this in the Indian embassy in Tel Aviv. Again, some of the hospital directors were also there. And this is in the Tel Hashomer Hospital in Israel. Again, Ofra organized this. And Dr. Dorit is a very renowned scientist there in Israel. And they organized this lecture. Actually, I had to give a lecture on PTSD, that is post-trauma stress disorder. But just when I was going to make the PPT presentation, Dr. Dore told me that, Dr. Prasad, can you show it on a patient? So I had to close my laptop, and then I said, okay, bring the patient. So the patient came, and I took the history of the patient, and then besides the PTSD, he also had low back pain. So I decided at that time, so why not go for the low back pain treatment? Because if I do the PTSD now, then the effect maybe will come in the next day, and the patient will be able to give feedback afterwards. And when he came walking to the hospital, then he was with a limping gait, and so when I took the history, he did say that he had a bullet injury in the calcaneum. Actually, the bullet was still lodged inside the calcaneum, and that is why he was having difficulty in the walk. And the terrorist did try to slit his throat, but he survived. That was the reason why he was having this PTSD. So we did the marmas for low back pain in this patient at that time, and he gave a very good response. And some of the best psychologists and even the acupuncture PhDs were present there. So the patient gave a feedback that actually when we did the marmas and asked him to walk, his gait has improved, and this is what impressed the scientists there. And when the patient was asked, how do you feel, then the patient said that I feel that I can put more weight on the leg. This is again an Indian embassy in Hague, organized by Sapna Foundation. This is in Poznan. So the doctor in ophthalmology is a good friend, Dr. Mazana. She organized this. This is from the Ministry of Nepal, Government of Nepal, and this is the Health Minister of Nepal. So they are organizing a series of workshops for the government medical officers. So there are around 450 government medical officers in Nepal, and we have already trained around 5 groups, including the paramedics, around 1,500 paramedics. So we are training all of them, and those doctors who are training, they are also training their paramedics. So almost everyone in the Ayush field or Ayurved field there in the government sector will be having the basic knowledge, of course, of the marmas, and they will be treating patients, and they are already treating, because this has been going on for more than 2 to 3 years now. This was in Rishikesh. This is another case in Mexico. I'm not going to share the video right now. Okay, this is in Singapore, a case of tennis elbow. And this is the feedback in 1 minute video.
I was introduced to Marma therapy early part of this year when I had a very severe tennis elbow. And even with the regular physiotherapy sessions, I did not find any relief. And it just so happened, a blessing in disguise, that I was introduced to this session, and I happily went thinking that I would be able to heal myself and others as well. And I was really thankful that I was actually healed of my tennis elbow problem.
So she's organizing one more workshop. She already organized one workshop earlier, but she's also organizing one in January 2023. She had tennis elbow, and after the marmas, I did the marmas, and I did tell her what are the marma points that you can do and follow. And already been nearly 2 years, and she has not had any more problems with the tennis elbow. So now coming to the marma therapy. So marma therapy is the art of stimulating the marma points exactly at the right time, place for rechannelization of energy, yielding better energy flow and optimum therapeutic effects at physical, psychological, and spiritual levels. If you go on and see the historical background of the marmas, then the first reference of the marma comes in the Rig Veda, where the term Varmam has come. And since we know that Rig Veda is the oldest literature known, so we consider that the science of marmas is the oldest, among the oldest sciences known to mankind. And it's not just in Rig Veda that the term or the references of these important energy points has come. It has also come in other places like Upanishad, Atharva Veda, and there are many places in which you find the references of marmas. Of course, more wide description we will find in the texts of Ayurvedic literature, where we have the Charak Samhita, the Sushruta Samhita, Ashtanga Sangrah, and Ashtanga Hriday among the major ones. So we have a detailed description about the marmas there. Of course, Sushruta was the one who described it in an elaborate way, and Charak did say that there are 107 marmas, but Charak went on to explain 3 of them in more descriptive or more elaborately. Sushruta mentioned about all these marmas, the anatomical sites, the locations, and the resultant of injury on the marma site, what can happen if those marmas get injured, and also what the type of marmas are, what are, like whether there is a sira marm, whether it is a muscular marm. So the different kinds of classification was done by Acharya Sushruta. And there are references of Suchi Vedhan as well, with needle puncture. See, in Sushruta, in Rakta Mokshan, besides the Marma Chikitsa or Marma chapter, there is a mention of the Rakta Mokshan. So in Rakta Mokshan also, for example, in hepatomegaly, Sushruta says that you need to do the Rakta Mokshan or bloodletting from Dam Kurpar or right elbow. However, similarly, there is the reference of doing Rakta Mokshan in Plihodar or splenomegaly. And similarly, there are other, like in Dridhrasi, there is a special mention where you need to do the Rakta Mokshan. So if the idea of Sushruta was to give relief only by giving or by taking out the blood and that producing its own therapeutic effects, then it could have been any vessel. So since Sushruta mentioned specific sites, that means Sushruta actually knew that site, just beside giving the relief because of the bloodletting, it has its relationship to that particular organ and organ system. And that is why Sushruta mentioned that you have to do in specific diseases, specific sites, the needle puncture or the Rakta Mokshan. Otherwise, there is no logical explanation that I can think of. So the only logical explanation that I could think of is that Sushruta did mention about those sites, that because he knew about those energy channels and the concepts of those energy relationship and the concepts of the relationship to the specific doshas. So that is the reason why Sushruta has mentioned that you have to do those bloodletting at that specific site. And marmas are basically related to those energy channels or the chakras, as we call in our Sanskrit literatures and in Ayurvedic texts as well. So the relationship and marma and yoga is also given by Shandilya Upanishad and in Vashishta Samhita also, which are the famous literatures of yoga, where in Shandilya Upanishad it is mentioned Ashtadasheshu Marmasthaneshu Kramata Dharanam Pratyahara. So on 18 sites, there are 18 marma sites where you have to do the Dharan Kriya, and that Dharan Kriya is called as Pratyahara. And in Vashishta Samhita also they say the same thing, that Pratyaharam Prashasanti Samhita Yogina Sada Ashtadasheshu Yad Vayor Marmasthaneshu Dharanam Sthanata Samkrashya Pratyahara Sacha Uttamaha. So on the Ashtadasheshu, so 18 marma side, you have to do the Dharan Kriya, Kramata, so one by one, right? And that process of doing the Dharan Kriya on the marma sides is referred to as Pratyahara. So the concept of using the marmas in a kind of stimulation of the marmas has been there in our literature, because in the Ayurvedic texts also there is a reference by Acharya Sushruta in 5th chapter Sutrasthan, where Sushruta says that you have to use certain kind of herbs mixture for dhupan karma in Vrana, right? So dhupan karma in Vrana is a kind of different wounds, right? So he says that the same dravyas or the same dravyas siddha ghrita can be applied on pranana samalabhet, on the prana sides. So what are the prana sthan? The marmas are considered as the prana sthan. So there you have the reference that Sushruta has mentioned about the stimulation of the marmas for therapeutic effects. Of course, there are several other references, like simply doing the Hriday Basti. Hriday we consider as a marma site. The Shiro Basti, there you have many marmas in the head region. Janu Basti, Janu itself is a marma site. So there are several indirect ways in which they have mentioned about stimulation of the marmas. Of course, putting in oil or putting a grit has its own effect. I'm not saying that it doesn't. It's only that the stimulation of the marmas will work when you do the Hriday Basti or a Shiro Basti. The medicinal, the drugs that you use, that has its own effect. But of course, there is an additive effect of doing of getting the marmas stimulated at those specific sites. So coming to the description of marma in Ayurveda, it is also mentioned that Maryanti iti marmani by Acharya Sushruta, and it's also mentioned by Ashtanga Sangra that apicha marin karitvat marma. Like, if there is severe injury on the marmas, then it can lead to fatality. It is by Sushruta and also by Ashtanga Sangra. So this was one of the reasons why there was a thought process that why should we stimulate the marmas, because any stimulation on the marma can lead to fatality. But if you go on and think about it, then in almost everyone in everyday life, we are touching the marmas or stimulating them in some way or the other. It's just that we do not know that we are stimulating it, right? So just doing oiling in the head itself, that you have certain marmas, that even the simple process of doing the abhyanga itself stimulates the marmas. So it's not that you cause any fatality out of it, because this was the question that was asked in the ethical committee when we gave the first thesis topic for research to a student, and this was the question told, that since in the Samhitas it is mentioned that Maryanti iti marmani, then why are you touching the marmas? Do not touch the marma. There's something that's sacred. So then the answer to that was that, you see, every day you are doing it, every day you are touching. It's not Sushruta did not mention about this in the sense that only the touch can cause this fatality. It is the severe injury, it is a severe trauma that can lead to fatality. Of course, if a severe trauma happens in the cardiac region, in the heart, in the head, it can lead to fatality. We all know that. But it is, if you just touch, just gentle pressure, it does not. So we have used this and applied it clinically in many of the patients, and we got very good results. And it is not just in few hundred patients, there are thousands and thousands of patients that now we have treated through marmas. And also now with whomsoever we have shared this experience, they themselves have also treated thousands of patients in different clinical applications. So they have also got good results. The importance of marmas is quite evident from this shlok, where Sushruta mentions about marmani shalya ardham utaharanti. That means marmas are considered as the half of the surgical science. Of course, the vivid description of the marmas are also in the reference that you have to protect the marmas when you're performing those surgeries. If we go on to discuss the classification of the marmas, there are 107. They are structural, regional, prognostic, dimensional, and numerical classification. There is also the description of Varmam very vividly in the Siddha science, and more prevalent in the southern Indian states. And the father of Siddha is Agastya Muni. But the reference of Agastya Muni also comes in Charak Samhita first chapter, where it has been mentioned that 53 rishis learned the science of Ayurveda. And among those 53, has the name of Agastya Muni has also come. And the father of Siddha is Agastya Muni. So it could be that there are two parts of the same coin. So if we go on see the structural classification, then we have the mans, sira, snayu, asti, and sandhi. So these are the 5 ones which are described by Acharya Sushruta. The 6th one, which has come as an addition from Acharya Vagbhat from Ashtanga Hriday. Okay, so some of the marmas which are told, like Sira Marm by Sushruta has been discussed as Dhamini Marm. Some of the Mans Marm has also been considered as Dhamini Marm by Acharya Sushruta. Some of the Snayu Marm has been considered as Dhamini Marm by Acharya Vagbhat. So for today's description processes, we will be following the Sushruta's concept of Mans Marma being 11, the Sira Marmas of 41, Snayu being 27, Asti is 8, and Sandhi being 20. So Mans is that which is more muscular in nature, Sira is that which is more vascular in nature, Snayu is more ligamentous or tendinous in nature, and Asti is the one which is more bony, and then Sandhi is that which is more joint. So we have to understand the probable mechanism of action as well, because why the patient had better shoulder joint movement, why the patient felt relief when we did the marmas for the tennis elbow, and several other cervical spondylitis patients and low back pain patients as well. Right? So we have to have certain mechanism acting behind it. It can be explained on the basis of energy concepts. It can be explained based on the Tridosha concepts and based on some of the modern parameters. So based on energy concept, this is one of the most important experiments. It was carried out by Professor Korotkov and the team in St. Petersburg University in Russia, because we all know that whether living or non-living object, we emit certain kind of energy radiation. It's just that we cannot see them by the naked eyes. However, we can visualize them through the Kirlian camera, which was designed by Professor Korotkov, and there's a specific software to read it. Right? So what he did was he carried out an experiment with a water droplet, and you see, this is the water droplet. The energy field of this water droplet was mapped before doing meditation or before energizing it through this camera, which was developed by Professor Korotkov and the team. And then he asked an energy healer by the name of Alan Shamak to concentrate for 10 minutes or meditate on the side for 10 minutes. And after doing the meditation, the water droplet energy field was mapped again. And the difference in the bioenergy glow is dramatic. This is what's written here. The biochar water has more than 30 times stronger aura vibration and significantly altered physical and biological properties. So this is one of the landmarks in the experiment or understanding of basically bringing out the feeling that we have in everyday life about the energy into black and white paper and understanding more in the scientific terms. But if you go on and see in this one here, in this energy field and electrophotonic analysis, they have mentioned that see, for each chakra, the program produces the value, asymmetry, and interpretation of chakra energy in compliance with the Ayurvedic concepts. In chakras evaluation, both position and size are significant. Chakra analysis usually is more related to the psychological and spiritual condition of a person than to physical. So the concept of this, Professor Korotkov has also acknowledged that they have done it from the Ayurvedic sciences. So how beautiful our science has been and how deep it has been. Based on this, there has been a meta-analysis as well, and 132 papers on GDV, and this again yielded the result that the use of energies therapy or energy sciences have a very, very important and comprehensive scientific background. Marmas are, of course, the connections or direct relations to the energy system, and that is why we are sharing this. We did also use this concept. Basically, it was our father, Professor Shishir Prasad, who did this published this paper in unique color circle design for a novel scribing tool to identify cancerous skin lesions, and use the concept of energy. This is the thought forms and image analysis, another paper published in IEEE. Some of the PG thesis work that we have already done, I've just mentioned a few of them. Clinical study on effect of marma therapy in management of Pratham Patalgattime with special reference to myopia. This was in collaboration with the Shalaka department in Rishikul with Professor Gunjan Sharma Madam, who is the head of department there, and also my wife, Dr. Renu. So this was the first thesis basically on clinical applications of marma. There were many earlier on the anatomical aspects of marmas, but the clinical ones was not there. And since then, there have been many more in pipeline, and many more have been completed. There are several ways in which a marma can be stimulated, like doing simple meditation and mantra, yagya and home, yogasana, pranic healing, reiki. So there are several ways in which marma can be stimulated. But Sushruth has mentioned that our hands are the best instruments, and hence we use our hands to do the stimulation of the marma. And also it is said that the Tvak Indriya is directly connected to the mana. So when you are touching and doing, then you're also connecting to the psyche of the patient. So I'm just going to tell you about the cervical neck pain first, and then some of the marmas, the self-marma therapy for low back pain, and a few points for stress management, because these are some of the most common problems people are suffering from. I don't know whether from IIP, Priyanka ji is present or not in the group, in the talk today. Deepen ji, are you here? Okay. So for cervical neck pain, there are three marmas that we generally stimulate, which is the Ans, Kurpar, and Chipra. So Ans marma is a snayu or a vaikulikar marma. The size is Ardhangul, as mentioned by the Sangitas. So this is the site of the Ans marma. We use two fingers, the index and the middle finger, for stimulation of the Ans marma. I'll show on myself how to do that once I complete about this theoretical aspect of the three marmas. The Kurpar marma, there are two, one on each elbow region. There are two sites of stimulation for the Kurpar marma. It is a joint or a sandhi marma. The size is 3 finger breadths. Location is 1 finger breadth downwards from the elbow crease, both on the medial as well as on the lateral aspect. So if you draw a line, straight line here, just 1 finger breadth below the elbow crease. And if you draw a straight anterior midline here, approximately 3 finger breadths on the medial side of this lies the site of a stimulation of the Kurpar marma. Kurpar marma, of course, is the whole of the elbow joint is considered as the marma, but how to stimulate whole of the joint, and this came basically by clinical experiences and feedbacks of also of the patient, that if you did from this side, then we're not getting the right result. If you did from this, then the result was not adequate, but if you did it on this point, then the result was much better. So this is born out of observation as well, and then later on, many thousands of patients we have done through this. So the site of the stimulation is 1 finger breadth on the medial aspect, and also on the lateral aspect or on the outer side of the elbow, just 1 finger breadth below the elbow crease, and 3 finger breadths approximately from the anterior midline. Once you have identified the point, we use the thumb or the inner side of the thumb to apply pressure in the direction of the olecranon. And the number of times that we do this stimulation is 20 to 25 times in one sitting. All the three marmas of the Ans, Kurpar, and the Chipra In one sitting, we do 20 to 25 times of intermittent stimulation. So you make an imaginary line from this point to the olecranon, and also from the lateral side, one by one, an imaginary line drawn from here to the olecranon, 20 to 25 times intermittent pressure in the same rhythm in which we take our breath in and out. So press when you exhale and release when you inhale. One press and release will take approximately 3 seconds. In a day, you can do 2 to 3 times. If the more chronic case like hemiplegia, hemiparesis patients, then maybe up to 5 times also you can do. So again, this is the midline here. Although there are 3 marmas depicted in this, I'm just going to explain about the Cooper. So this is the anterior midline, so approximately 3 finger breadths from this side and 1 finger breadth below the elbow crease. Lies the site of stimulation, the lateral site of stimulation of the Cooper marma, and 1 finger breadth below the elbow crease again, and 3 finger from the medial side. This is the medial side, right? Now this is the Shishir marma in between the index and the thumb, approximately 2 finger breadths above. At this site here lies the Shishir marma. There are certain references which says that Shishir marma is on both the sides of the hand, that is dorsal and as well as the palmar aspects. So when we do follow a specific technique, then basically both the sides we take care of. So this is again the Shishir marma of the lower limb, but not for the cervical pain, because when you're doing the low back pain sequence, then we will need to know about this Shishir marma of the lower limb. The only difference between the upper limb Shishir and the lower limb one is that the location is approximately 1 finger breadth above in between the 2 fingers. The direction of pressure is slightly towards the thumb. Again, an intermittent pressure of 20 to 25 times in one sitting. So now I'm going to show you how to do this stimulation. So for the stimulation of the Ansa marma, we have to place our elbow like this, okay? If this is the mid-axillary line, so we make an approximately 30-degree angle and use the index finger and the middle finger like this. So from the point where the neck joins the shoulder, you have to go approximately 2 finger breadth behind that. Okay, so don't go too close to the neck. Approximately 2 finger breadths behind on this muscle, which is trapezius muscle. So you use this 2 finger. Once you have identified the point, then make an imaginary line from here to the sternal notch and then try to apply pressure in that direction. A moderate amount of pressure can be applied on this side. See, if the marmas is of Sira type or a vascular type, the amount of pressure that we apply is very gentle. The other 4 types, we can apply a moderate amount of pressure. The amount of pressure is not fixed on all the marmas, even if it is non-vascular or the other 4 types. The amount of pressure will vary from marma to marmas. Okay, so however, the general principle you can say that on the vascular marmas or the Sira marmas, the amount of pressure has to be very, very gentle. The amount of pressure on the other 4 types can be moderate. Moderate, like in some cases, it can be around 6 to 8 pound pressure. It can some 4 to 6 pounds, some 2 to 4 pound, like that. And it's easy to measure the pound pressure as well. You can just place your thumb on a weighing kitchen weighing scale and see what the recordings are there. And similar amount of pressure you can apply, because it's not a fixed point by point pressure. You have quite variable. So around, as I said, around some cases 2 to 4 pound. So you can get an idea about what the pressure that you have to do, or a similar amount of pressure you can apply on the marma side just by reading the scales. And I was telling about the Angul Pramana also. Then another question arises, what is Angul Pramana? So for that, you measure the base of the forefinger and divide it by 4. So that becomes 1 Angul. And when we talk about the Angul Pramana, then the Angul Pramana is of that particular person. So if I have to do on a patient, then it's the patient's Angul Pramana that I have to take, not my own. So you have to place your elbow like this, and then 2 fingers goes here, like this, okay? So cervical neck pain, I'm mostly talking about the musculoskeletal and neuromusculoskeletal origin cervical neck pain, right? Okay, so the whole of the finger, if you try to bend like this, then the force tends to move forward. Instead of going in this direction from here to here, the force tends to move in the forward direction. And this is a common mistake that people do, even though they can identify the correct point, but the direction of pressure, if it is not correct, then the effect is also not adequate. So it's important that we know in which direction the pressure has to be applied. So when you're pressing it, so better try to fold only the terminal interphalangeal joint, or the last part of the finger here. Try to fold only this. There will be some fold of this middle finger, but not the entire one like this, okay? So it will be more like this when you are doing stimulation. So this will be slightly bent here, like this, okay? Keep the elbow attached or close to the chest. If you are making it like this, then you may reach further than the desired site of stimulation. So don't need to do it like this. Keep the elbow close to the chest and then do the stimulation. And this has to be done 1 by 1. Don't do both of them together like this. So 1 by 1. Right? So this becomes the Ans Marma. Sometimes when you wake up in the morning, you get a stiff neck. So just the stimulation of this Ans Marma and the Kurpar Marma takes care of that. You don't need to take any muscle relaxant or an analgesic for 3-4 days for that. And just 3-4 times of stimulation is sufficient to take care of that muscle pain when you get a stiff neck, suppose when you wake up in the morning. So I hope it is clear to this one, the Ans Marma. Now we come to the next one, which is the Kurpar Marma. So for the Kurpar Marma, self-stimulation, we draw a straight, just like this, a line like this, okay? And if you draw, as I showed it in the figure, so 1 finger breadth below, so 1 finger breadth below here. So this becomes one site of stimulation. This is approximately 3, right? So this is again approximately 3 on the other side. Okay, so these are the 2 sides of stimulation. And you have to place your elbow above this bony prominence of the olecranon here. So just place the hand above this bony prominence, and then the thumb goes like this, okay? So once you have placed this here, make an imaginary line from this point to this and apply pressure, just like this. Don't pinch, not like this. No pinching should be done. The skin, the pulp of the thumb should be more parallel, okay, like this. You will have slight tenderness around the area when you do the stimulation. So it has to be prognosticated, or if you're doing for the self-marma therapy, then you need to know that there will be some tenderness. And actually, when especially in this point, if you feel tenderness, that means that you are at the right point. Do it better in empty stomach. don't do it immediately after taking food. If you are a diabetic patient, do not do it completely empty stomach, but do it after 2.5 hours after taking some food, right? So again, just like this. So this is the medial aspect of Kurpar Marma. And then when you have to do the lateral aspect, then for that you place your thumb on the bony prominent area here, and then use the index and the middle finger. Flex your elbow, the palms should be facing upwards. Okay, again, so with the help of the middle and the index finger, I'm applying pressure in this direction. If you, from the same point, if you apply pressure like this, then the effect will again be not adequate. So you have to understand again which direction the pressure you're applying. Okay, so this is one. Kurpar Marma, two sides, self-stimulation, and then the chipper one, which is quite easy. The Kurpar one does take some time to practice, but still one can learn. It's not like one cannot do self-marma. So for the chipper marma, it's more simple. You just have to place your index finger on the thenar eminence on this, the prominent part of the hand. You put your index finger here like this. If you place it in the center, then you will not be able to properly stimulate when you reach the point. So it has to be remembered where you are placing the index finger. So you place it here and then use the pulp of the thumb. So you see, now this is the webbing. So you go 2 finger breadths above the webbing. So in the center here, so this is the point of stimulation, right? So once you've identified the point of stimulation, then place it here like this, and then use the pulp of the thumb. Again, do not do it like this. Use it parallel to the skin surface, slightly towards the thumb. If you do it directly downwards, again, the effect is not adequate. So you have to place the thumb slightly towards the thumb. This one, the pressure has to be slightly towards the thumb. It is slightly tender when stimulated, not much painful. Slight tenderness can be there. The arm or the hand should be kept in a way like you're holding a glass of water. So it has to be very relaxed. In that way, the muscles are relaxed, so that you will be able to stimulate it better. Okay, so these 3 we can do as a regular practice when we have cervical spondylitis, for example, or even spondylosis patients. We can do these 3 marmas. If the pain radiates more towards the occipital region, then we can include one more, which is the cricatica.
Dr. Shishir, is this recommended because we're using computer? So because we're using computer, would you advise to all of us to do it regularly to avoid?
Yeah, if one can do it regularly. Self-marma therapy, there's no problem, one can do regularly. If the person is suffering from those cases, as I said, cervical spondylitis or spondylosis patients, they can do it regularly, 2 to 3 times in a day. Of course, it has to be done under medical guidance, not like just I talk and start doing it. Any procedure has to be done under medical guidance and with the consultation with an Ayurvedic doctor, right?
So also, sir, what marmas are like the one that you showed now? Are they also for preventative issues? Like if we want to avoid this spondylosis because we're using computer, because we drive a lot, so should we do that regularly, at least once a week or once a day, or when we do such actions?
Yes, good question. And yes, we can do it even regularly, once or twice a day. We can do it to especially those people who are working in the field like computer work, a lot of sitting work. right? And there's some people who tend to lift more weights. So in those cases, we can definitely do it regularly to avoid having such problems. Yes, we can do. So, and also the stress management sequence that I will be sharing. So those also one can do regularly, even if there is no pathology.
I know it's not Vedicus activities, but still I would like you, can you please share your plans for January and March when you're going to be abroad and how people can approach you there?
Oh, okay. So yeah, in January, on 13th of January, I will be in Singapore. There is going to be a workshop in Singapore. Then on 13th night, I will travel to Melbourne. And 14th, 15th, there will be 2 days workshop, hands-on training for the practitioners there. It will include some physiotherapists, some natural practitioners, naturopaths, and of course Ayurvedic doctors as well. And then move on to Perth on 18th. Then we have 19th and 20th, 21st. We'll have the workshop in Perth, and then back to India on 24th. And and then I have a couple of workshops in Portugal and Italy in the month of March. I think in the first week of March and also in the second week of March.
And then on April, we start semi-online with you. You're going to give the first lecture online, and then we're going to have hands-on in Israel with the courtesy of the Embassy of India. Mm-hmm. And let's hope that you're going to be our guest in Yoga Day. It's part of the Vedicus activities globally. So let's pray for your next visit here. And thank you so much. If anyone have any questions, please open your mic and camera and share your doubts or questions with us. Or later in the Vedicus WhatsApp group, you can also share. Dr. Shishir is there. And we highly recommend that you will get to Vedicus portal and to the YouTube channel. And you can see there Dr. Shishir's advice about how to practice Marma therapy. Because we have many articles there and there will be more. So please, Dr. Hema is here. And I can see more friends here. Hello,
Dr. Hema, would you like to share also? Dr. Hema has been doing well in US with the Dr. Hema being an MBBS doctor, and she is practicing. It's really, really good to. Dr. Hema, would you like to share your experience?
Please.
Hi, Dr. Shishir Prasad. It's wonderful to hear your lectures. So actually, I'd been to India for a month and I just returned, but definitely I use your Marma therapy for stress management. It's it's in high demand here actually because of the pandemic and everybody works from home and a lot of stress with more responsibilities in the house. So, many people are very happy with the stress management marmas. So, I do that very often here with my clients.
And how is your patient with the child with the hoarseness of voice you did?
That one, yeah, it's slowly improving, but I think they also need to see a pediatrician for speech therapy. Much better than what it was initially when they came to me. So thanks to you and your tips.
Thanks to you that you're the one who intervened. Thank you.
Thank you.
It's for those of you who practice Ayurveda, I would like to tell you that Dr. Shishir is very open to suggestions. The stress management sequence have also helped to conceive. It's not just that you need to go to do IVF. You can do Marma therapy if you want to conceive easily. So you can ask for advice from Dr. Shishir. And
you are the one who did it. And,
I did it because you said, yes, please do that and let's try. And you're very open and you're supporting. So without your support, many things wouldn't happen in my clinic and for the benefits. So thank you, sir. And thank you for supporting Vedicus. You also participated in our last medical camp, which you consulted and organized with us, and it was amazing. We still see the fruits, and we hope to have more, because we think that you believe with us that people should have balanced life and happiness, and we will continue to do the grassroots, and you know that we have you to support us and do whatever is needed to be done.
It's a combined effort always.
Thank you.
Yeah,
Thank you so much. We would also like to thank Mr. Aditya Jain, that without him, all of this could not have been happened. He is the wind behind, like under our wings, and his enthusiasm and his efforts are those that allow us to be here and talk about our passionate in life.
Yeah.
So please
Thanks,
have a very nice journey and Happy New Year. And we'll see you again next year. All of you, if you want to join more lectures, please stay tuned on the WhatsApp group and Facebook and like all the other channels. We will share with you more info about more science. And I guess we'll have Dr. Shishir maybe about Kshar Sutra, but let's see how I'm going to persist.
Dr. Hiren is also there. Dr. Hiren is just
Gujarat.
Dr. Hiren has already
Yes.
The governor of Gujarat. As I know, Dr. Hiren, would you like to share?
Please.
Very good evening, sir.
Very good evening, Dr. Hiren.
I am very happy to share this everything.
Yeah.
Due to your pleasure, I have learned too many things, and so many patients are very happy right now. And I am going to finish my PhD in February 2023.
Wonderful.
So I am very happy, and so many people are very happy. So I have treated 4 to 5 cases of lateral lumbar canal stenosis. And MRI also, it will get relief in 1 year therapy. One patient's come L3, L4 spinal canal stenosis is 4.6, and 1 year therapy it will be increased from 4.6 to 6.5, and patients is too much happy.
Wow. So this is the best thing that you see.
Yes.
It's not only that I do and the treatment result. There are so many people worldwide now doing, and they're getting the feedbacks that like you are sharing. So that is the best thing that can happen. And that is also, it's also important to say that Marma science is such that even there are so many cases which are non-responsible to a common treatment protocol, but when you include the marmas, then the patient starts to respond. So this is something really, really amazing, Dr. Hiren, and it's really great to hear the feedbacks from all of you.
My sir thesis is in cervical spondylosis, but so many patients are come from others than cervical spondylosis for treat for Marma therapy. So I am very happy to see the science and everything. So I too much nowadays to learn more in Marma therapy, sir. So again, for revision, I have joined again to you, sir.
Wonderful to see you. Wonderful to see you, sir. Amazing.
Thank you. Thank you.
So thank you all Veda Acharyas. I don't want to call you doctors. Doctors is a Western Veda. Ayurveda Acharya is what you are because of the knowledge that you share. And it's a vast one, and it's from the heart, and it's amazing. So please keep inspiring us and teach us. And let's see you all next year. And take care.
Ofra, there is a couple of questions before I end. I think
we have questions.
Dr. Rima Dada wants just, I think Dr. Rima has asked me that, okay, please inform that you have a workshop. Sure, Dr. Rima will share the, whenever we're doing an offline anywhere in India, then I'll let you know.
Yeah, we will let you know. We're going to tell them. Yeah, people are asking for more information. Don't worry, Dr. Shishir is restless because he's like this, and he will give more, and we will let you know when he's available offline, globally, not just in India. And he gives more, and just keep in touch with us, and you can send us a private message either to Dr. Shishir, and if you're not in the WhatsApp group, then send me a message now, and I will give you the WhatsApp group link. And Dr. Hiren is there, and Dr. Shishir have so many students, and we keep in touch with him all the time. Trust me, morning, evening, night, during dinner, every time. So he can always reach us because Dr. Shishir is there and we follow. So it's going to happen. You will have more.
Okay, thank you.
Oh, so welcome.
Ofra, there's one more question. Dr. Ravi Devan has asked, which marma did you refer to for occipital radiation of the? So I said about Trikartika marma. So that is near the posterior aspect of the neck, and from the midline, you have to go towards approximately 2.5 finger breadth on the either side on the occipital region. So this is the site of the stimulation for the Trikartika. And this is the one which we include in cases. So I hope it answers this question. Later on, of course, we will have more. Yeah.
We can contact you for advice, right?
Yeah.
And I think that we have Trikartika and a website. And if we don't have it in Vedicus.com, that we will have an article about this. It's good because it's for the people to ask us, and we are going to give them the knowledge. So it's very good.
Thank you, Ofra, so much. Thank you, everyone, for joining.
Thank you, Vedicus, for
organizing.